Hi, I'm Gary Sutton. I'm host of the Gary Sutton Show on WOYK Radio, 98.9 FM and 1350 AM WOYK, Monday through Friday, 6 to 9. And I'm sitting in a different kind of chair today that I'm going to tell you about here in just a moment. But one of the things that a lot of people maybe know or don't know about me is I've suffered from clinical depression for a long time in my life. I've managed to get control of it, and I take a small amount of medication now each day. But you know what? I know what it's like to see the dark side, and I know what it's like to have to go through the idea of hopelessness and not being able to be helped and keeping a good balance in life. And so when I went through various treatments over the years and had to go through all of what I went through, I always had that in mind. Well, you know, we think we know all there is to know about depression right now in terms of psychology and psychiatrists and pills and all those kind of things, and yet there are still people out there who are suffering, of the 280 million people worldwide who have depression. And it's good to know, and that's why we're doing this video today, that there is something else that might just be there to help you. That's why I'm sitting in this chair today, which we're going to explain more about later on. It's called NeuroStar. But before we get to that, I wanted to introduce you to a man I have great respect for. He was an orthopedic surgeon here in York for a long time, and now he is the head of York TMS Clinic right here at 1806 North George Street in York. He's Dr. Gracia Eaton, a man that many people have trusted with their lives in terms of their knees, like the two knees I have now that are put in there surgically. But now we switch to something else today, the mind. And what happens with depression? A lot of people think, oh, I'm depressed. That's a different kind of thing than clinical depression, which is more like a condition that affects a lot of us in this country. And Dr. Etienne is going to explain what that's all about now. And then I'm going to come back here to the chair, and he's going to show you how the NeuroStar treatment actually works. Here's Dr. Gracia Eaton.
Well, thank you, Gary, for the introductions. Just like you said, my name is Dr. Etienne, Gracia Eaton. I was an orthopedic surgeon who somehow found my way through I would probably say a passion project into the management of depression now. So we embarked about 2 years ago with York TMS Clinic, and it would be a pleasure for me to sit down with you and discuss depressions and how TMS can be used as part of the armamentarium in the management of depression. Quickly, before we go into question and answer sessions of the presentation, let me just tell you a little bit about depression. Regardless of what the etiology of depression is, the common pathway is that the neurons in the brain, the cells in the brains, are actually completely dormant. I mean, they are inactivated. And that's how we try to manage depression, either through medicine or through psychotherapy, trying to reactivate those cells again. But unfortunately, there are so many times when, in spite of medications, patients cannot get the results that they are looking for. And that's when TMS, transcranial magnetic stimulations, comes in play. And like I said, it stands for transcranial magnetic stimulation. It's essentially using magnetic pulses to stimulate the neurons, the brain cells, through the skull. It is based on the concept that when patients are in the state of depression, the cells are dormant, so if you stimulate them very low pulses repetitively, the cells will eventually awaken and start transmitting again and connecting, and eventually you can strengthen those connections and get patients a long-term results. Actually, I have behind me one of the pictures that can even illustrate that. This is a picture of a PET scan. When you look at a PET scan looked at activities anywhere. So it looks at blood flow, glucose metabolism, and oxygen consumption. So if you take a PET scan of a patient with depression, as you can see, it appears very dark because there is no activities. After treatment, or if you are dealing with a patient who does not have depression, you can see a lot more activities, and that's actually how TMS actually works and get us the result that we're looking for.
So Dr. Etienne, I'm sitting here in the NeuroStar machine, which is kind of like my chair at home I sit back and watch TV on at night. This is not at all scary. It's sitting here. But one of the things I wanted to ask you is, for a lot of people, they'll say, well, do I have to go to my doctor to get referred to you to take the NeuroStar treatment? What would your answer be?
Well, at York TMS Clinic, I can say that we are very proud to offer a proven non-drug therapy for depression. The NeuroStar concept is great. To answer your question directly, you do do not need any referral from your primary care doctor or from your psychiatrist. You can self-refer for that, and whether it's simply for an informational consultation or a clinical consultation, just stop by, show up, go in the email, or in any other way we will be able to help.
You can go to YorkTMSclinic.com too. They're located right here at 1806 North George Street here in York. One of the other questions that people would normally have would be, do medical insurances cover this?
I like to joke on that, and I tell people that this is not hocus pocus. This is not voodoo medicine. It's not like finding the hole, somewhere and just do it. No, this treatment is FDA approved and covered by all the commercial major insurances, including Medicare.
So that's a good answer there. Now, here I am sitting in this NeuroStar chair, and I thought it might be interesting for people who hear me talk about this on the radio a lot, but they're trying to envision it. And people say, oh my gosh, are you in a tube? Are you, what do you do? But it's not threatening at all. Each of these treatments takes about 19 minutes. Is that correct?
Yeah, this is actually a very good question. When we're talking about magnetic stimulation, we're talking about using very low pulses. Right. It's basically the equivalent of going to get an MRI for your hip or your knee or something. It doesn't hurt, except it's very annoying because you're in a tube. But like you see, sitting in the chair, we're only using one coil, so you're not sitting inside of a tube. It's very well tolerated by patients. There is absolutely no pain involved at all. Some patients say they feel a little noise or something like that after the treatment, the first couple, but eventually that goes away.
And for people who would come here and let's say they've tried medicines, they've tried psychotherapy, they've tried psychology, they've tried psychiatry, and again, none of those are bad, are all good. This is like adding another piece to the arsenal in attacking depression. And you'd say to yourself, well, can you afford not to know about this? It's something new, maybe to York, but it's not new to the world, right?
Yeah, that's correct. Transcranial magnetic stimulation itself has been used in Europe since the 1990s, and no issues. It's been adopted in United States and FDA approved since 2008. I don't want to use the term of revolution because that term is being overused. But to me, I think it's a significant improvement in the management of depression. It is a big tool in the armamentarium because people need to know that if medications do not work, it's not the end of the world because there is one. And I can even underline, as I'm talking about that, the success rate of TMS. Right now the literature is talking about 83% success rate with a 62% remission rate. So that is a significant improvement, especially when you consider that TMS at this point is indicated for medication-resistant depression. So these are patients who have tried 2, 3, or even sometimes 4, and even multiple meds before and have failed. So therefore, you're taking the patients who are the hardest, having the lowest success rate, and bring them to that high, not counting the fact that there's no interaction with any other medications, there's no side effect, that all the nasty side effect that you can have with antidepressant medicine. When
you look at this, you say, okay, clinical depression, but there are other things that this helps to deal with as well. Talk a little bit about clinical depression, maybe the boundaries on that, so to speak, or the parameters.
Yeah, TMS right now for FDA approval, strictly FDA approval, we have OCD, anxious depression, or MDD, which is medication-resistant depression. However, there are other centers that are using, and either for research or for off-label use. It's being used for migraines and for nicotine addictions, for alcohol addictions, all kinds of anything that is affecting the brain right now. There are protocols that's being developed. I think for us at this point, we can say we have not done that yet, simply because they would be off-label use. But I know personally patients who have benefited from those off-label use.
So I come to York TMS Clinic right here at 1806 North George Street in York, and I say, Dr. Etienne, I'm coming here for my appointment today, so take me through an appointment. I'm in the chair. This is called the NeuroStar treatment. NeuroStar. You can check it out at neurostar.com. But this is the machine that you use. I'm sitting in a living room setting. I don't have to put any special gown on or anything like that. I'm just sitting in my regular street clothes. I just drove in myself. I'm going to drive home myself afterward. Take me through how I would go through a normal treatment here, Dr.
Yeah, this is actually a very good question, because we need to emphasize that there is absolutely no negative effect on your cognitive ability after this treatment. I mean, you come in, you get your treatment, you drive in and drive out. And I know professionals, and I don't have to name something. I'm not naming names, so it's not against HIPAA. I mean, you can be a physician, you can be a nurse who will come in and get your treatment and then continue your day after that. I mean, there's absolutely no problem on that, except the inconvenience of being here for about 19 minutes. But I usually tell people that I know for sure that, let's just say 36 sessions, Gary, 19 minutes, 19 times 36 divided by 60, that's less than 12 hours.
Wow.
I can guarantee anyone, if you suffer from depression has taken more than 12 hours of your life. So that's not too much to give up for for a chance as being successful. To answer your question now, you know me, I give you a little bit each time. To answer your question, the treatment sessions is very simple. The first time we were blessed enough, I can say that, we're proud to say that, to partner with NeuroStar that doesn't use a helmet. We use one coil. Okay, and it is based on the fact that it's not the entire brain that controls the mood. So if we can find that simple area, and that's the only area we stimulate, we don't have to send the pulses through the entire brain. And that's why the first treatment, we do what's called a mapping. Okay. The psychiatrist will actually try to locate that little, I don't have to give you the technical term, but let's just call it the mood center. So if you can find that mood center, that's where the coil will be sitting, and that's the only area that's being stimulated. So that's why the first treatment takes a little bit longer. In addition to the fact that you're going to be in the chair for about 19 minutes, we need to make the chair as comfortable as possible for you, because that can be adjusted with the headset and turning it and so on. So once we do that, the treatment itself can vary anywhere from 18 minutes to 20, but somewhere around there. It's never that much longer than that. The subsequent treatments, we don't have to reset the chair. We don't have to figure out where that thing is, that little mood center is, because we already know we can see, we have that. And I'll try to give you a little demonstration. Yeah, so the subsequent treatments, we already have everything saved in the computer, so we set it up. When you come in, you sit down, we bring the chair in the position and bring the coil in. We have our landmarks. We can bring this up and down to bring it where it is. And then we bring the coil right there. 19 minutes later, oh, by the way, I need to tell you that you're going to have conversation with us. When you're in the chair, we tell you, don't sleep, talk to us, let's just talk. So we know each other. I mean, by the time, Simone is great as initiating conversation and stimulating people to talk. So by the time you're done, we know your life, you know our lives, and then, that's the treatment.
I had a chance one day to talk to someone who actually had the treatment going on, and it was just regular conversation, other than you're sitting back relaxing in a chair like this. So let's show people what a demonstration would look like here, and what how non-threatening this really actually is.
Okay, good. Give me 2 seconds. Sorry for turning my back. We just bring that in. Let's just assume that you're sitting there for subsequent treatment. I'm gonna put this around your neck. It doesn't do anything too serious. This is just as a reminder for you not to move your head. Because when you move it, you can feel it, because remember, the coil is gonna be in one position. We prefer that you keep it there. So let's just say we'll have this right around there. Again, you can overpower it if you move, but it serves as a little reminder. So we bring the chair to not a real beach chair, but more like a lounge position. Okay. You can put your head back. Okay, to a lounge position. And then we check and make sure that this is in the position where it's supposed to be. So once we end, we go ahead and set that in. So that, again, just that little thing is just to encourage you not to move, because if you try to move your head, you can feel like something is pulling.
Gotcha.
So once we do it, the second thing that we do, since I'm gonna put the coil on the other side, I just put a little foam, almost like a little counter, so that when I push, your head is not going all the way. So yeah. So now remember, before we get to this, you would have had the mapping and everything done. So I
Everything's
know
already in the
exactly.
computer.
I know exactly. And if you look through here, there's some numbers there where I know exactly how far to bring this. When I put it, there's an angle there. I can actually know if it's up and down this way. We would also know if we should turn this, so we can control the location, the angle, and the tilt and everything. So let's just say in your case, let's imagine that through the mapping we found out this is where we should put the coil.
Gotcha.
Right there. So once I have that, so the next thing is to really take this and set it right where we need to do it. And just say, Mr. Sutton, are you ready for your treatment?
I'm all ready for the treatment.
Bam, we're starting.
Wow.
19 minutes later, you're done. And for some people, it's gonna be a little bit further down. It may be there.
Sure.
Okay, it may be, again, that's
It all
fairly
depends on the
individual.
mapping.
Exactly. The advantage also is the fact that the strength of the pulse can differ also. What it takes to stimulate my neurons may be different than yours. So NeuroStar allows us to do an individualized targeted treatment for specific patients.
So it's not a one-size-fits-all.
Which is really awesome.
That's what you like.
Bam, bam, bam. 19 minutes later, I basically bring this up, and then we bring you to your original position.
Gotcha.
And then take that out.
And I feel like I did before.
Yeah.
And we walk away.
Yeah.
Now, you mentioned about 36 treatments of 19 minutes each.
Yes.
Does everyone go through that many, or is there a different number you can go through depending on where you're at? Talk a little bit about that if you would.
Right now, the recommendation is to use 30 to 36. We usually do 30 simply because that's what the studies were done with. Okay. If someone comes back, for example, and said, "Oh, I feel like I'm getting a little bit in the darkness again," like we call it maintenance or retreatment. Some patients will do 10 treatments, and others will do 18, and then once they get back to their regular self, they don't have to continue with the 36. But the first time, it is recommended to get 36 treatments.
One of the questions I know people would ask, and they've asked me in talking about this, what could you potentially expect over different periods, like 0 to 5, 6 to 10, those kind of things? Because people want to know, is there a success rate on that? And maybe we could show that up here a little bit. I don't know.
Yeah, I had a slide that would do it. Yes. The response will vary significantly. Actually, there are some patients who will get 1 or 2 treatments and start bouncing back, never look back. And actually, we had one patient who literally had 1 treatment. The next day, he came in and basically said, "Oh my God, I've never slept that well in my life, and I can dream better," and so on. And we said, "Oh, just calm down. This is not it yet." But he never looked back and do fine. Unfortunately, there is also something called dipping. And I can try to explain it to you. Some patients experience that. Not everyone experiences it. Where when the cells awaken, those patients may go into a little bit more depression for a short period of time. That usually happens by the end of the first week, the second week, but they bounce back very quickly. And one of my favorite stories is actually a patient who was ready to quit when she actually had the dipping, and I kind of through good bedside manner, interesting, we managed to get her to continue, and she really, she did so well. But what you'll hear patients telling you over and over again is how they feel like gradually the veil is coming down and they can see better, they can dream better, they can think better, and so on and so forth. We have our testimonials there. If you look at that board, you can see it's just amazing what patients are actually experiencing. There are also some cases, I have to admit, where patients will actually go through the entire 36 treatment not sure whether or not they really responded to it. And then a couple of weeks later, we'll tell you, oh my God, I just didn't know if this thing was going to work. There are also patients who may not process it well, Gary. I've had patients who didn't know if they were doing well, but a family member will tell them, hey, listen, just remember what happened to you and how you process this. Sometimes the change is so insidious and so smooth that patients don't even realize that. But I can tell you from what I've seen myself, it does work. There's no doubt.
Well, as we look at you out there right now, and you say to yourself, okay, well, that doesn't look too threatening, but think about this. If you are suffering from depression, if you have a family member who's suffering from depression, a friend, and they've gone through a lot of different things and they haven't been able to really get all the relief that they want, could you do worse than stopping by here and getting some information about it as we've given you today? You've had a chance now to see what I talk about a lot on the radio, which is York TMS Clinic. They're located right here at 1806 North George Street, right here in York. You can find them at yorktmsclinic.com. And I would suggest to you that this is yet something else that if you could help someone to feel better, could you afford not to take a look at it and find out more information at least about it before you ever take part in it? I believe in it significantly. I believe in what Dr. ATN has brought to York, and I believe in the TMS way of doing things. Check it out today, yorktmsclinic.com, and you can stop by here at 1806 North George Street right here in York and see them yourself. They'll be glad to show you everything you need to see in terms of the literature and all the things about it. It is a wonderful new way of helping people who have clinical depression. Help about today, will you? I'm Gary Sutton.